Today marks the end of World Hearing Week, and every year this initiative is held to raise awareness on how to prevent deafness, now hearing loss, and promoting ear and hearing care across the world. For more on the causes of hearing loss, we're joined by medical specialist and educator, Professor Mashudu Tshifularo. Welcome to you, Prof. It's great to have you on the show this morning. Thanks for coming.
Thank you so much.
And you were up very early too.
Yes, I have to wake up very early today.
What causes the loss of hearing, and what are the first signs of hearing loss that we can observe, especially when we're looking at perhaps children and elderly people?
There are many causes of hearing loss, and one of them, it can happen when you are children or when you are born, so the child is just born deaf, so that we call it congenital, or it happens intrauterine. And then the other component is when they are young children or youth. Those are usually the acquired causes that can be caused by some medication. There are some medication that we call them ototoxicity. In other words, if you take them, they will damage the hearing. That's why when you are pregnant, you must tell the doctor that I'm pregnant, because the early stage of pregnancy is very, very sensitive. The painkillers, the antibiotic, they can damage your hearing. And then when you have things like other conditions like diabetes, hypertension, that's when the elderly. So the elderly, there is what we call normal degenerative. So there's wear and tear. I usually tell them that your batteries are flat. So I say that we can replace them. But, and then you can have trauma, you can have infection. And then, but the commonest one, which I see in the youth, is sound. So if you are exposed to a very, very loud sound, like you're in studio all the time. Exactly. So after the party, when you come out there, you feel like there's ringing sound in the ears. That's when the sound has started to affect what we call the cochlear hair cells. And so it's very, very critical. But the first thing that you'll notice that somebody is having a hearing loss, because there is sensory and there's conductive, and then there's what we call perceptive. In other words, the brain cannot interpret what you're hearing. So when you say hearing loss, it's just that we categorize everything together.
So it doesn't just end with our ears, and it doesn't just end with sound.
Exactly. So it needs to be interpreted somewhere. So you might just find that every system, the conductive, the middle ear, the cochlea, and the nerves are fine, but the brain cannot interpret what you're saying. It's like when you don't understand the language, you'll just hear the sound. So when we say hearing loss at our level, we have to find out where exactly is the level of deafness.
Wow.
And depending on the different level, we can have different treatments.
And Doctor, does South Africa have enough resources and audiologists to address these challenges, and how big of a problem is it in South Africa?
It is a big problem. Nationally, WHO always state that around 7 to 10% of the population, they'll have some form of hearing loss. So, and just losing a hearing, the people say that when you lose hearing, you have lost contact with the world. But when you are blind, you can feel your way around, you can hear. But imagine you cannot hear even the sound of a bird, a sound of a moving car. It's like you're watching a TV without a sound. So you are completely isolated from everything else. So it's a big problem.
Is there a way for us, not those ones born without hearing, or the elderly that have started to lose their batteries, as you said, but is there a way for the rest of us to sort of prevent infections and prevent hearing loss through various strategies or forms of therapy that we may do?
I think many is a lifestyle issue. So you have to make sure that you are not exposed to loud noise all the time. That's why we talk of noise-induced hearing loss. So those headphones must not be on your ears, and don't have so loud music, and be careful what you take, like medication. And more than any other thing, make sure you go for your regular checkup.
And how often should we do those checkups?
At least every 6 months. Just go and check, clean your ear. Don't put things in the ears by yourself.
Yes, we see people putting matchsticks, people putting bobby pins to try and clean their ears. Is that good, or is it shoving all the dirt back into the ear?
There's only one thing that I will encourage you to put. Just put your elbow.
elbow.
Yes, yes.
No earbuds.
No earbud. In other words, I'm saying don't put anything.
Nothing.
You cannot put the earbud. I say to people, it's like time to wash your eye. How often do you put water in the eye to wash it? So the creator makes sure that the ear is protected by what we call wax. When it's leave it blocking, it's sort of like affecting your hearing. Then go to a doctor or a specialist who will be able to clean it properly. Because everything you put, they're going to predispose you to infections.
And Professor, just in terms of awareness around hearing loss, are we doing enough in South Africa? What more would you advise that we do?
I don't think we're doing enough. I don't think we're doing enough. We need to do a lot of campaigns. We need to make people aware. And because once you lose hearing children, you realize that they love loud. So when they're watching TV, it's always very loud. They'll be affected at school. Their language will be affected because they cannot hear. And once you get people who speak very loud, you must know that they cannot hear. So they think everybody cannot hear them.
Everybody
so
else,
they have to put up their volume.
Thank you very much, Professor, for your time. It's been such an interesting conversation. Just a quick one before we go. Can children who are speaking loudly affect a parent's hearing? You don't have to answer that one. My mother used to tell us "Simbangela my nerves" when we were growing up. I just wanted to check that.
Yeah.
Hearing loss is on the rise worldwide, and more than 460 million people globally have disabling hearing loss, and this is according to the World Health Organization. This week was World Hearing Week, and we just spoke to medical specialist and educator Professor Mashudu Tshifularo. Well, to the moms out there, children screaming and making a noise is natural. Don't shout and say "Bakbangela my nerves." We're going to take a quick break. Do stay with us.